how this cancer is caused, and how do you describe to a patient when they come into your office what pancreatic cancer is?
So, cancer of any kind is really the malignant transformation of what used to be a normal cell into an abnormal cell. Okay. Here we have cells in the pancreas which have gained the ability to grow unencumbered and unrestricted and uncontrolled, and those tumors can grow larger in size, but more importantly, they gain the ability to invade other structures. They can grow and invade local structures near it, and they can also travel via the lymphatics, via the blood, into other organs and cause what we call metastases. Tumors in the lung, tumors in the liver, other areas that are distant from where the pancreas is.
And one of the things that we were saying is that with pancreatic cancer, there are usually no symptoms that are visible to the patient, which sometimes make it a silent killer. Is this true?
Right, so the issue with pancreatic cancer is that by the time a patient has symptoms, usually the disease is advanced,
okay.
Right? 80% of patients, once they have symptoms, will have disease so advanced that they may not be a candidate even for surgery, all right? Symptoms are contingent on where the tumor is located. Tumors in the body or the tail of the pancreas tend to present with much more advanced disease because they tend to grow unencumbered and unrestricted and don't present with symptoms because there's nothing around it that it can really grow into that will present with certain symptoms. Now, a tumor in the head of the pancreas, because it's so firmly associated with the duodenum, or the first portion of the small bowel, the bile duct which drains the liver, here patients, even with a smaller tumor, can present with jaundice, abdominal pain, nausea, weight loss. So we tend to diagnose these patients at an earlier stage, but by and large, by the time you have symptoms, the disease tends to be advanced.